Can you tell us why in 1984 Lulu Quarter belonged in kids rather than at home with her mother and in school?
I remember that she was acting out. She was very overweight. And no, other than that, I don't remember. She was a problem. Her mother brought her to us to have her assessed.
With respect to her acting out, do you know of any way at all in which she acted out prior to the time she came to kids?
That was a long time ago. I vaguely remember an incident where she acted out in a car to get her sister or her mother to stop and buy food or something. The way she started to dress became a problem for her mother. That's all I remember.
What about the way that she started to dress became a problem for her mother?
I don't remember exactly.
Do you remember anything about a hairstyle she wanted to have becoming a problem for her mother?
No.
Why should any adolescent not go to school because they're overweight?
I don't believe I said that they shouldn't.
Well, patients were admitted to treatment at kids because they were overweight, were they not?
Never just for that reason.
Were they admitted as patients to kids just because they had eating disorders?
Yes.
Why should an adolescent with an eating disorder, ever not get to go to school?
I don't know how to answer that question. There are, degrees of eating disorders. If it's interfering with their life, if it's interfering with their family relationship, if it's interfering with their self-image, there's several reasons. It's never just you're too skinny, you're too fat.
Why should an eating disorder that interfered with somebody's family life and each of the other things you just mentioned prevent them from going to school?
I don't understand the question.
Isn't it important for adolescents to be in school?
If they're capable of carrying out what they're supposed to be doing in school. If they're preoccupied or cannot learn or whatever, then they need help.
Doesn't taking somebody out of school for as much as a year represent a very substantial interruption of their normal adolescent development?
Not if they're in need of treatment.
Were you aware when you came to start Kids in New Jersey with your husband that there were laws that required all adolescent children to be in school?
Yes.
Well, if there were laws that required all adolescent children to be in school, why were kids' patients not in school?
That was all researched and taken care of, and they were legally out of school.
Why didn't kids make arrangements? Strike that. Why didn't kids make arrangements for teachers to be brought into kids to provide some education for the patients who were there?
I don't know.
Did you ever consider it?
I'm sure it was talked about, what was in the best interest of the kids.
Do you have any information at all that suggests that Lulu Quarter ever used alcohol or drugs before she became a kid's patient?
No.